Occupational medicine is a practice of medicine where we deal with employers and employees in getting them ready for work and also taking care of injuries that may occur during the workplace. Hi, I'm Kelly Yoxall. I'm the Medical Director at Occupational Health Partners.
Well, Dr. Yoxall, thanks for being on the show. First of all, why don't you tell us all the services you do at Occupational Health Partners?
Thanks for having me. We do a lot of services, mainly to try to make it as easy for companies and employers in the area throughout the North Central Kansas region to take care of their employees. We do pre-employment physicals, we do post-offer screens, we do Department of Transportation physicals, we do audiograms, hearing testing, vision testing, we do diagnostic imaging as far as x-rays, we do obviously, a big part of our service is workman's comp for injuries and post-injury care and return to work care. Our focus is trying to get the employers and employees on the same page with keeping them safe and getting them to return to work and be functional members of their employee team.
Fortunately, COVID is kind of winding down a little bit, but how did it affect you guys at Occupational Health Partners?
It was difficult at times. We weren't able to go on site visits to to companies we try to do that to make our services better and tailor them to their needs, and we weren't able to get out there just due to the restrictions on travel and being around other people. But we were able to offer some enhancements where we did go out and do COVID immunization clinics in different companies. We had companies send their employees to us, so that was different, although we've done that with other immunizations, but just not with COVID, obviously.
I know your goal is to get employees back to work and in a healthy environment. Why don't you talk about the process with that, with an injury?
Initially, when the company will call and say they have an injured worker, depending on what it is, we try to get them in as soon as possible. And most times it's same day. We then evaluate it and try to ascertain, the injury for the medical part of it, but also what their job entails and then what we can do to keep them in the work environment in a safe manner. We try not to keep people from working, but we just want them to be able to perform in a safe manner. So a lot of times we will make accommodations at work or in fact formal restrictions on things they should and shouldn't do to try to get them back. Then we follow up and whatever it takes, whether it's time or aggressive physical therapy, medication, or referral to a subspecialist, we manage that until the patient's able to get back to be in their regular position if that's possible.
Well, thank you so much for some great information and for coming on the show. And thank you for watching. For more information, please visit salinaohp.com and like Salina Regional Health Center on Facebook. Follow us on Twitter and Instagram.